तो अगर हम लोग फर्स्ट टू फोर्थ हार्ट साउंड देखें, फर्स्ट हार्ट साउंड, सेकेंड हार्ट साउंड अकर्स बिकॉज ऑफ AV valve closure and semilunar valve closure, whereas third and fourth heart sound occurs during rapid filling of the ventricles. During rapid filling, first rapid filling and a second rapid filling. First rapid filling, third heart sound, second rapid filling, fourth heart sound. ठीक है, rapid emptying of the atria into the ventricles, मतलब ventricle का ही filling, atria का emptying, this similar thing, same thing. So S4 is produced during atrial systole, because atrial systole is the time where the second rapid filling is going to happen. Where the second rapid filling is going to occur. Understand that. Very, very important point to understand. Second rapid filling is going to occur during atrial systole. Physiological S4 is recordable but inaudible in children and the young adults. So, second rapid filling produces this kind of sound. Causes of pathological S4 क्यों होगा? Hypertrophic cardiomyopathy, systemic hypertension, coronary artery disease. Now we can also see a gallop rhythm. Gallop rhythm is a additional heart sound that can be heard. Triple rhythm with tachycardia.